In this video, our subject is infection control. We will discuss the chain of infection, breaking the chain of infection, an introduction to infection control, techniques of medical asepsis, methods of proper hand hygiene, using personal protective equipment or PPE for standard precautions, using standard precautions, and using transmission-based precautions. In healthcare facilities, infection can spread easily from one person to the next. Why? Well, first of all, many of the people in healthcare facilities are there because they are being treated for an infectious disease. As a result, you have many infectious people in close proximity, both to one another and to the people who are free from infection. Secondly, people who are already ill are more at risk for infection from other people simply because they are in a weakened, more vulnerable condition. And they're also more susceptible because, in many cases, they are elderly or very young. During a typical workday, you will interact with many patients or residents. In other words, you will become a common link between them. Unless you and your coworkers take special precautions, you can become the means of passing on illness from one person to another as you move from room to room providing care. Not only that, you or your family could become infected as well. That's why the skills in this video are so important. The principles and techniques of infection control you will learn will help you prevent the spread of microbes that cause infections and illness in patients, in residents, and in you. Organisms that are too small to be seen with the naked eye are called microbes. Examples of microbes are bacteria, fungi, viruses, and parasites. Some microbes are harmful or even helpful, but others can cause illness. Microbes capable of causing illness are called pathogens. When a pathogen causes an illness, we call the illness an infection. A communicable infection is an infection that can be transmitted from one person to another. Some infections are more easily transmitted than others. In order for a person to acquire a communicable infection, 6 key conditions must be met. Together, these 6 conditions are the links that make up the chain of infection. By breaking this chain, you can help stop the spread of communicable disease in your facility. The 6 conditions in the chain of infection are pathogen, reservoir, portal of exit, method of transmission, portal of entry, and susceptible host. In order for the chain of infection to remain intact, each of these conditions must be present. Condition number 1 in the chain of infection requires that a pathogen be present. Pathogens, remember, are microbes capable of causing illness. A reservoir is a place where something is stored or held in reserve. In healthcare, a reservoir is any place where a pathogen can live while waiting for an opportunity to infect someone. Condition number 2 in the chain of infection requires the presence of a reservoir. Potential reservoirs include the bodies of humans and other animals, food and water, and objects called fomites that have come into contact with an infected person's body or body fluids. Pathogens collect and live in these reservoirs, and in some cases they multiply. The third condition in the chain of infection is that pathogens must have a way to leave the reservoir. That is a portal of exit, or an exit door. A pathogen might leave via the respiratory tract in mucus, via the gastrointestinal tract in feces or saliva, via the skin in blood or drainage from a wound, or via the urinary tract excreted in the urine. The fourth condition in the chain of infection is that there must also be a method of transmission. That is, a way for the microbe to get from the reservoir to another person. Direct transmission requires close contact between an infected and a non-infected person. In such cases, the reservoir consists of the infected person's body or bodily fluids, and the method of direct transmission of infection could involve touching the infected person or breathing contaminated air after the person talks, sneezes, or coughs. Indirect transmission involves a fomite, again, an object or surface that has been soiled or contaminated by an infected person. Transmission occurs when a non-infected person touches a fomite. Examples of fomites that can be easily contaminated include drinking glasses, side rails, and bed linens. Indirect transmission may involve a vector instead of a fomite. A vector is a living creature, such as a mosquito, tick, or rodent, that transmits a pathogen. Examples of diseases that are transmitted by vectors include West Nile virus, Lyme disease, malaria, and plague. Condition number 5 in the chain of infection requires a portal of entry, that is, a doorway into an uninfected person. The same organ systems that served as portals of exit also serve as portals of entry. Portals of entry include the respiratory tract, the gastrointestinal tract, the genitourinary tract, and breaks in the skin. Medical devices such as indwelling catheters, feeding tubes, and intravenous lines increase a person's risk of infection by providing more efficient pathways through these portals. The 6th and final condition in the chain of infection is that a susceptible person or host must be available to the pathogen as a new target for infection. The key word here is susceptible. After all, there is a never-ending onslaught of pathogens struggling to gain entry at the many portals into the human body. The body's defense system is capable of fighting off most of them, either through natural defenses or with the assistance of medications and vaccines. But when those defenses fail, we become susceptible hosts and complete the chain of infection. People with reduced defenses have an increased likelihood of becoming hosts. People who are very young or very old, those in poor general health, people undergoing chemo and radiation therapy, those who are under stress or fatigued, and people with indwelling medical devices, all are at increased risk for having reduced defenses. You can break the chain of infection by removing any one of the 6 required elements or links. You can eliminate a reservoir by ensuring, for example, that bedpans are properly cleaned after each use. You might eliminate a portal of exit by ensuring that the person's dressings are intact, notifying the nurse that a dressing needs to be reinforced with tape, for example. Eliminate a common method of transmission by properly disposing of contaminated items containing blood or body fluids, for example. When appropriate, use designated biohazard containers. You eliminate a method of transmission when you clean items that may have become contaminated with pathogens. And the most important way to eliminate a method of transmission is by always performing proper hand hygiene. Prevent a portal of entry by wearing gloves and other personal protective equipment. Finally, you can further break the chain of infection by reducing the susceptibility of hosts, maintaining your own general good health, and receiving required immunizations. Help to make you less susceptible as a host, and when you help your patients or residents to maintain their good health, you help them to become less susceptible. Remember, each time you break a link in the chain of infection, you can prevent an infection from spreading. All healthcare facilities follow basic practices of infection control designed to decrease the chance that an infection will spread from one person to another. The 5 major methods of infection control that apply to nursing assistants in a healthcare setting are medical asepsis, surgical asepsis, barrier methods, standard precautions, and transmission-based precautions. Medical asepsis involves killing or physically removing pathogens from surfaces, equipment, and the hands of healthcare workers, which prevents the spread of infection from one person to another. Medical asepsis is accomplished primarily by using soap, water, antiseptics, disinfectants, or heat. To prevent infection, surgical asepsis is used for procedures that involve entering a person's body, such as surgical procedures, injections, the insertion of urinary catheters, and the insertion of intravenous catheters. Barrier methods of infection control employ a barrier, that is, an object that physically prevents microbes from reaching a healthcare provider's skin or mucous membranes. We refer to the barriers as PPE, or personal protective equipment. Examples of PPE include disposable gowns, gloves, masks, and protective eyewear. The fourth type of infection control consists of standard precautions, which are precautions taken with every patient or resident to protect against pathogens that are transmitted in blood or other body fluids. The fifth type of infection control consists of transmission-based precautions, which are taken in addition to standard precautions when a person has a disease that is transmitted a specific way. It is essential that you follow your facility's guidelines on infection control in each of these 5 areas very strictly. In the sections that follow, we'll provide you with some detailed tips on the most common techniques for infection control. Proper medical asepsis begins with sanitation, which includes such basic techniques as hand washing and providing clean linens and clothing. Antisepsis takes sanitation one step further and requires the use of antiseptics, chemicals capable of killing a pathogen or preventing it from growing. Antiseptics can be used on the skin or other surfaces and include rubbing alcohol, iodine, and some types of soaps. Using an alcohol-based hand rub for hand hygiene is an example of antisepsis. Disinfection involves the use of stronger chemicals to kill the pathogens, chemicals too strong to use on the skin, but which are effective on non-living objects that come into contact with body fluids or substances, objects such as bedpans, urinals, and tray tables. Sterilization is the most thorough method of killing microbes and is used on objects such as surgical instruments that must be completely free of any microbe. As a nursing assistant, the technique of medical asepsis you will use the most frequently is hand hygiene. Hand hygiene consists of both thoroughly washing your hands, using soap and water, and the use of alcohol-based hand rubs. Hand washing is still the best method of decontaminating the hands, and the consistent use of both methods of hand hygiene continues to be the most important method of preventing the spread of infection. That's because the most common method of transmission of healthcare-associated infections, that is, infections gotten while in the hospital or other healthcare setting, is on the hands of healthcare workers. And that means on these hands and on yours. Most healthcare-associated infections are caused by transient flora, which are organisms picked up from touching contaminated objects or people who have a communicable disease. When you properly perform hand hygiene, you remove these organisms and help prevent infection. The first step in following the practices of good hand hygiene comes even before you arrive at work. Keep your fingernails short and unpolished, and leave your jewelry at home. Long fingernails and jewelry can trap microbes and are extremely difficult to clean. First, we will demonstrate how to properly wash your hands. It's likely that the supplies you need will already be present at the hand washing area. If not, it's your responsibility to locate any necessary supplies, such as soap or another facility-approved cleansing agent, paper towels, and a waste container. As optional supplies, you might consider hand lotion, or, in certain healthcare settings, or if your nails are visibly soiled with blood or other substances, a disposable nail cleaner or orange stick. In some instances, hand washing is the best method of hand hygiene. Hand washing, instead of using an alcohol-based hand rub, is required when you first arrive at work, before you go on break, and before you leave your shift. Before and after drinking, eating, or smoking. Before and after inserting contact lenses. After using the bathroom. After coughing, sneezing, or blowing your nose. After touching anything that may be contaminated with blood or other body fluids or substances. When hands are visibly soiled. when hands are visibly soiled with or in contact with blood or other body fluids, when caring for patients or residents who may have certain infections such as C. diff, after handling your hair or applying makeup or lip gloss. Begin by standing away from the sink so your uniform doesn't touch it. If you're wearing long sleeves, push them up 4 or 5 inches. If you're wearing a watch, slide that up too. Turn on the water and adjust the water temperature until it is warm, making sure that it is not running fast enough to splash out onto your uniform. Some sinks may be equipped with foot or elbow controls instead of hand-controlled faucets. Put your hand in the water stream with your fingers pointing down so the water runs off your fingertips and into the sink. Remember the phrase "down the drain." Do not allow water to run up your forearms. Dispense the soap or cleansing agent into 1 cupped hand. Lather well, making sure the lather extends at least an inch past your wrist. Again, keep your fingertips pointed down at all times so the water runs down the drain. Rub your hands together in a circular motion, washing both the palms and the backs. Put the fingers of one hand between the fingers of the other hand to clean the spaces between your fingers. Continue in this circular motion for at least 15 seconds. Then, rub the fingernails of one hand against the other hand's palm to force soap underneath your fingernails. Alternatively, you might clean underneath your fingernails with a disposable nail cleaner or the blunt edge of an orange stick. Rinse your hands, again keeping your fingers pointed down at all times. Dry your hands thoroughly with a clean paper towel, beginning with the fingers and moving upwards to the wrists. Dispose of the paper towel in an approved waste container, being careful not to touch the container. Use a new paper towel to completely cover the handle, then turn off the faucet. Dispose of this towel also without touching it to the other clean hand. You may apply a small amount of hand lotion to keep your skin supple and moist. As you leave the hand washing area, open the door by covering the knob or handle with another clean paper towel. If there is no knob or handle, push the door open with your hip and shoulder to avoid contaminating your clean hands. While nothing can replace the effectiveness of good hand washing to remove visible dirt, blood, or other body fluids or substances, the CDC issued guidelines in October 2002 recommending the use of alcohol-based hand rubs for routine hand decontamination. Alcohol-based hand rubs have several advantages. Using an alcohol-based hand rub is quicker than washing your hands at the sink, which means that during duties that require frequent hand washing, using an alcohol-based hand rub can save time. Alcohol-based hand rubs are gentler on the skin than soap and water. Alcohol-based hand rubs are used without water, so they can be used anywhere. In many facilities, alcohol-based hand rubs can be dispensed at the patient's or resident's bedside, saving many trips back and forth to the sink. Many even come in containers small enough to be carried in your uniform pocket. Remember, if your hands are visibly soiled with dirt, blood, or other body fluids or substances, you must wash them at the sink using soap and water. However, if your hands are not visibly soiled, then it is acceptable to use an alcohol-based hand rub to decontaminate your hands, instead of hand washing. Alcohol-based hand rubs are appropriate to use when your hands are not visibly soiled, before entering a patient or resident's room, before and after patient or resident contact or contact with surfaces in the patient's or resident's room, before entering a clean supply room, before obtaining clean linen from the linen cart, before handling a person's meal tray, after picking up an object from the floor, after removing or changing disposable gloves, including those times when you are replacing a torn glove, when moving from a dirty body site to a clean body site when providing care. Many facilities use automatic alcohol-based hand rub dispensers. Check the instructions for the correct amount of product you should use. Apply the hand rub to the palm of one hand. Rub your hands together, covering your hands and fingers, front and back, and in between the fingers with the product. Make sure to clean the fingertips and rub the fingernails against your palms to force the product under the nails. Continue rubbing your hands together until they are dry. Apply hand lotion if desired. Personal protective equipment, or PPE, is a barrier method of infection control used to protect you from exposure to a pathogen. The type of PPE required will vary according to the potential method of transmission of the pathogens from person to person. For example, airborne diseases such as measles and tuberculosis are transmitted by the respiratory tract, so to prevent infection, you would wear equipment that protects your respiratory system, such as a mask. Other infections only require gloves to protect you. The main thing to remember is that you use the PPE to block the portal of entry of any infectious microbes into your body. In any situation that requires the use of PPE, you must first start by performing hand hygiene, and then use the particular barriers that are necessary for the task at hand. In many situations, you'll use multiple barriers. In these cases, we recommend you put them on in this order: gown, mask, eyewear, and gloves. Remove multiple items of PPE in this order: gloves, protective eyewear, gown, and mask. Gloves are always removed before you reach up towards your face or neck to untie or remove other items. And remember, any used barriers are considered contaminated, and the outside of contaminated barriers should not make contact with your skin in order to prevent the transmission of microbes. Disposable gloves are perhaps the most commonly used barrier method of all, and they are recommended for a variety of situations. Gloves should always be worn if there is a possibility of coming into contact with blood or other body fluids or substances. Here are some key points to keep in mind about disposable gloves. The gloves must be intact with no holes or tears. Replace any damaged gloves immediately. If you need to replace a glove during a procedure, use an alcohol-based hand rub before putting on the clean gloves. Gloves must fit properly. If the gloves are too tight, they will be uncomfortable and may stretch, decreasing the effectiveness of the barrier. If the gloves are too loose, they may slip from your hands. Gloves are most commonly made of latex. But if you have, or the person you are caring for has, a latex allergy or sensitivity, use approved gloves made of another material. Remember that protecting yourself from pathogens is only one step toward breaking the chain of infection. When your gloves contact a pathogen, when you've touched another person, for example, or any body fluid or substance. The outside of the gloves becomes contaminated and the gloves must be removed before touching any other surface or person. Otherwise, they could transmit pathogens to whatever you touch next. Here are the steps to safely remove your gloves. With one gloved hand, grab the other glove at the palm and pull the glove off your hand. Using your ungloved hand, slip 2 fingers underneath the cuff of the remaining glove. Remove that glove, turning it inside out as you pull it off. Dispose of the soiled gloves in an approved container. Then, wash your hands or use an alcohol-based hand rub according to your institution's policy. Gowns are called for when there is the possibility that your uniform may become soiled with body fluids or substances. Using a gown as a barrier prevents your clothing from being contaminated. The gown is considered contaminated if it becomes wet or soiled. Paper gowns, by far the most common type in use today, are disposed of after one use. Fabric gowns, if used at the facility where you work, must be laundered after each use. Let's look at the proper way to put on and take off a gown. To put on a gown, if you're wearing a watch, remove it and place it in your pocket or on a clean paper towel. If necessary, push up your sleeves so that they're 4 or 5 inches above your wrists. Perform hand hygiene. Gather your needed supplies, which are a gown and gloves. Put the gown on by slipping your arms into its sleeves. Secure the gown around your neck by tying its ties into a simple bow or by fastening its Velcro fastener. Reach behind you and overlap the gown's edges so that your clothes are completely covered. Secure the gown at your waist by tying the ties in a simple bow or by fastening the Velcro. Put on the gloves so that the cuffs of the gloves extend over the cuffs of the gown. To remove a gown, remove and dispose of your gloves. If the gown ties are in the front, untie the waist before removing your gloves. Loosen the waist by untying the ties or unfastening the Velcro. Unfasten the neck. Be careful not to touch your neck or the outside of the gown. Grasp the gown at the neck fasteners and pull it loose and down over your shoulders. Be careful to touch only the inside of the gown and pull it away from your body and off your arms. Hold the gown away from your body. Roll it downward, turning it inside out as you go. Take care to touch only the clean side of the gown, what used to be the inside when you were wearing it. After the gown is rolled up, with its contaminated side on the inside, dispose of it in an approved container. Finish by performing hand hygiene. Masks are worn when caring for a person who has an infection that can be transmitted through the respiratory tract and are worn any time there is the possibility that blood or body fluids may splash or spray towards your face. Masks work to protect the mucous membranes in your mouth and nose from becoming contaminated. There are many different types of masks that are worn depending on the task to be performed and personal preference. Many types of masks have attached eye protection shields and serve to protect the eyes as well as the nose and mouth. To put on a mask, gather your supplies, which in this case is a mask. Perform hand hygiene. Place the mask over your nose and mouth, being careful not to touch your face with your hands. Tie the top strings of the mask securely behind your head. Tie the bottom strings of the mask securely behind your neck. Make sure the mask fits snugly against your face so that you breathe through it, not around it. To remove a mask, untie the bottom strings first, and then untie the top strings. Hold onto the top strings and remove the mask. Then, holding the mask by the ties only, dispose of it in an approved container. Perform hand hygiene. Protecting your eyes as a portal of entry is very important when there is the potential for body fluids to splash. If you're working with anything that might splash, you'll need protective eyewear such as goggles, face shields, and other devices to protect your eyes. Blood and body fluids, even the fluid used to irrigate wounds, can splash and transmit pathogens into your eyes, a portal of entry. When removing protective eyewear, remember that the front may be contaminated, so only touch the eyewear by the side arms when removing. The fourth type of infection control, after medical asepsis, surgical asepsis, and barrier methods, is standard precautions. Because pathogens such as the hepatitis virus or HIV can reside virtually undetected in a person's blood, and because infected blood or other body substances can leave the body through any number of exit portals, you must treat every patient or resident you come in contact with as if he or she might be infected with a blood-borne pathogen. To do this, you'll employ standard precautions, which are precautions against blood-borne pathogens that must be taken with every patient or resident. Standard precautions include the use of personal protective equipment, as demonstrated previously, and which includes masks, gowns, protective eyewear, and gloves. The proper disposal of sharps, such as used needles, razors, or broken glass, in OSHA-approved containers. Note that contaminated broken glass items should not be handled, even with gloved hands. Instead, the glass should be swept up and disposed of in an appropriate waste container. Standard precautions also include the cleanup of spills of blood and other body fluids in an approved manner. Spills of blood or other body fluids must be cleaned up with an approved cleaning agent or a solution of 1 part household bleach to 10 parts water. Wear personal protective equipment while cleaning up spills. And standard precautions include hand washing. In order for standard precautions to be effective, they must be used consistently. They must become your standard of professionalism. Transmission-based precautions are used in addition to standard precautions when a person is suspected to have a disease that is transmitted a certain way. For example, via the air, in droplets, or by direct contact. Transmission-based precautions are used along with special environmental controls, such as ventilation systems, liquid waste disposal methods, and procedures for handling contaminated linens or trash to prevent the spread of infection throughout the facility. Any of the 3 types of transmission-based precautions can be used in combination with the others. Equipment that you use during routine patient and resident care should be disposable when possible, kept in that person's room, and not used for other patients or residents. Airborne precautions are used when caring for people infected with pathogens that remain infectious when suspended in air. When an infected person coughs or sneezes, the pathogens leave the body through particles of saliva or sputum. As these particles spray through the air, they dry out and remain in the air for a long time. Like dust, the dried out droplets containing pathogens are in the air we breathe and on surfaces we touch. Infections that are transmitted by airborne particles that are then breathed in include measles, chickenpox, tuberculosis, smallpox, and possibly SARS. Airborne precautions include placing the person in a private room called an airborne infection isolation room that is equipped with special ventilation and filtration systems. Healthcare workers caring for a person on airborne precautions should wear a mask or high filtration respirator that is donned before entering the room. Gloves should also be worn when touching the person or items that may have come in contact with the person's saliva or sputum. Healthcare workers should also wear a gown when changing linens or providing care which would cause their uniforms to be against the bed linens or the person's body. And when the person leaves the room, she is required to wear a mask also. Droplet precautions are necessary when caring for people who have diseases caused by pathogens that are transmitted by direct exposure to droplets released from the mouth or nose. For example, when the person coughs, sneezes, or talks. Infections that are transmitted by droplets include mumps, influenza, whooping cough, strep throat, scarlet fever, rubella, meningitis, pneumonia, diphtheria, and epiglottitis. Droplet precautions are the same as airborne precautions, except that with droplet precautions, it is usually necessary to wear a mask only when you are within 3 feet of the infected person. Masks and gloves should be worn when performing procedures that involve contact with the infected person's mouth or nose, or when touching or handling items that may have come in contact with the person's sputum or saliva. Contact precautions are used when caring for people with diseases caused by pathogens that are transmitted directly, by touching the person, for example, or indirectly by touching fomites. For example, contact precautions are taken with patients or residents with skin and wound infections, digestive tract infections, some types of respiratory tract infections, and head lice or scabies infestation. Contact precautions involve using barrier methods whenever you must touch the infected person or items contaminated with wound drainage or body substances. Disposable items are used whenever possible, and items such as trash and laundry may be removed from the room only after double bagging. Patients or residents requiring transmission-based precautions may have to be kept in a private room with the door closed. They may not be allowed to leave their rooms unless it is absolutely necessary to do so, and the people caring for them must wear PPE. When caring for a person with a communicable disease, it is sometimes easy to forget that we are caring for a person with feelings, and that we risk making that person feel dirty or unwanted. Imagine how you would feel if healthcare workers had to wear gloves or a mask every time they came near you. When caring for a person with a communicable disease, your first responsibility is to help prevent the spread of infection to other patients or residents, to visitors, and to yourself.